Welcome to another episode of Beyond the Limits with your hosts, Matt Clark.
I'm Mike Forsyth.
Hello, Mike. Welcome back. So today we're talking about concussion, aren't we? This is a subject that is, I'd say it's quite near and dear to both of our hearts. And I think I will start by saying that you are potentially a bit of an expert on this, aren't you?
I'm certainly a concussion nerd in that I spend a lot of my life talking about concussion and thinking about concussion. So hopefully this should be the easiest podcast that I ever do in terms of our recording, but we'll see how it goes.
So Mike is being quite humble there. Mike is the head injury and concussion lead at Meliora Medical, a company that I also work at as a concussion specialist. So we've both got vested interest in this subject. I also work as a sports doctor and do some pitch side concussion work, as has Mike done previously. Let's get started then, Mike. Why are we talking about concussion today?
So this is not purely because this is hopefully a relatively easy episode for us to do. This is also, I think, because concussion is super important. In my view, it's one of the most poorly managed conditions by medical professionals generally, considering how common this is. So very few people seem to be able to diagnose a concussion unless they're very obvious. Even fewer people are able to describe actually how to treat one. And a lot of the guidance that is given out is quite out of date. So I love talking about this because I think it's something that can make a big change. And I think the first thing I would probably point out is that a lot of people will think concussion, they'll think contact sports, and they'll think, well, I don't play rugby, I don't play American football, therefore concussion's not really relevant for me. As we both know, that's largely irrelevant because actually concussions can happen anywhere. I mean, probably about 25% of the cases that I see in my clinics, and you'll be the same, will be from non-sporting activities. So walking into a door, standing up and hitting your head on a ceiling, these things happen all the time. So I think it is relevant. And I think all of us will have either had a concussion ourselves or will know someone who has. So actually having this knowledge, talking about this is really important. And I think what we're also going to do, very much in the theme of our podcast, we're going to talk a little bit about some of these claims that are made about devices or treatments that can either prevent or treat a concussion. And we're going to look at those in a little bit of detail to see what actually works and what doesn't.
You mentioned about it being poorly diagnosed, and it's probably worth giving a nod to how it's a huge spectrum, isn't it? And you've mentioned about most people having had a concussion at some point in their life, but how it is a real huge spectrum in terms of the severity. It's quite a contentious subject as well, isn't it? We know that there is a dedicated field of sports medicine now that meet on a regular basis to just sit down and talk all things concussion and try and keep us updated. And I think it's important, like you said, that more clinicians are aware of some of the nuance behind concussion, and also we're going to get onto, like you said, some of those practical steps and some of the do's and don'ts of concussion.
Yeah, totally. As you say, it is poorly understood and it is a little bit at times controversial. I think the first thing to say is that there's still this fairly widespread view that you can only have a concussion if you lose consciousness. That is patently not true. It's probably around 10% of concussions actually result in a loss of consciousness. I think in an adolescent population, it's perhaps even lower than that. But as you say, it's actually quite difficult to diagnose, and that's primarily because there is no perfect test for a concussion. So what we are reliant on as healthcare professionals is the mechanism of any particular injury, and then the symptoms that have happened shortly afterwards and then beyond. So I think classically we would say, well, there's headache or dizziness or feeling a bit sick or maybe feeling a bit out of it. But actually, there's a broad spectrum of symptoms that are described. Some people will hear ringing in their ears. Some people will just be a bit slowed down. There's a wide range of symptoms here. But as you'll have gathered by me saying those symptoms, is they're all quite non-specific. You know, I feel slowed down most days. I often wake up with a headache. It doesn't mean I've necessarily been sleepwalking at night and bashing my head left, right, and centre, or at least I hope that's not the case. So, I guess the other point about the controversy here is that anyone who watches sport, particularly who watches sport perhaps in the last 15, 20 years, will think back to images of people knocking their heads and stumbling around and, you know, blood pouring from a wound on the head. And when we look back at these people are clearly concussed, but a doctor or a physio will run out, get the magic sponge, dab away, and they'll be sent on their way back onto the pitch. And that's it's a really kind of old-fashioned approach to concussion. it's a very dangerous approach, dealing with what is essentially a traumatic brain injury. Again, I guess in the controversy, and we get asked this a lot, don't we? We sort of hear, well, yeah, I didn't feel great for a little while, but, a few hours later, I felt right as rain. Why are you telling me that I can't return to sport? But what that doesn't appreciate is actually that we know that symptoms going away doesn't necessarily mean the brain has recovered, and it can still be in this vulnerable state whereby there are risks there if this isn't managed correctly.
While we're talking about controversy, I guess it's another point to make is that it can be controversial making a concussion diagnosis, can't it? Did you see recently there was a Tottenham football game that happened, I think it was last week or 2 weeks ago, where the player clearly on camera took a concussive blow and was trying to negotiate staying on the pitch after, stumbling around and clearly not being quite coordinated. There was a few minutes where he was obviously not quite right, and the medical team was saying, "Look, you need to come off." And his facial expression, he was clearly angry. He didn't want to come off, and it can be quite a controversial point to make, particularly in an elite sports setting. And I think the awareness of concussion now coming more into the media is helping us deal with some of this controversy around the diagnosis, isn't it?
Yeah, totally. I mean, I didn't see the incident that you're talking about, primarily because I refuse to watch football because my football team don't ever win. But I did read about it, and I think you're right. I mean, but it's really hard, isn't it, as that clinician, because these are professional athletes, they're elite sportsmen. They're in their kind of warrior mode of wanting to perform and can't make good decisions. And they've got, 70,000 people in the crowd who want them to perform and win the game for the team. And actually, as someone who's saying, look, I think you're concussed here. Again, it goes back to that problem that there isn't a perfect test. So you are going on your judgment. And that those things can become very heated. So, yeah, look, I think you're exactly right to highlight those controversies. But I think that does then move us on quite nicely to actually focusing on the risks. So why is this important? Why is concussion become such a hot topic? And what's the risk if we get this wrong, if we aren't diagnosing this correctly and if we aren't treating this properly?
Okay. Yes, absolutely. So I think it would be prudent here to break down the risks into short, medium, and the longer term. With the short term being these obvious deficits that a player might be observed to have, i.e., their performance aspects. And this is in a sports setting, obviously. If someone's taken a knock to the head, are they then unable to perform at the level? Are they slower? Are they making poorer decisions? Are they not quite as able? And with that comes obviously the risk of further injury. We talk a lot about the player who's concussed on the rugby pitch. Are they then going to make poor tackles? Are they then going to be, that split second behind the ball that exposes them to getting another injury? This big one is second impact syndrome, isn't it, Mike? And we're aware that the brain tissue after it's taken a concussion can swell a little bit, and the consequences of getting a second knock to the head after a concussive blow, when there's these cellular level changes in the brain, means that the risk of a further knock or a second knock aren't just 1 + 1 = 2. These can be catastrophic. These can be exponentially damaging. And we've heard about those tragic cases in the news, the high profile sports players, and also children who've died from the mismanagement of concussion in the short term.
Yeah, it's probably worth just adding to that. Second impact syndrome is vanishingly rare. The cases are few and far between. It seems to exclusively affect the adolescent population in terms of the cases that have been seen. But when it does happen, it's catastrophic. And there's a really tragic and famous case of a Northern Irish schoolboy called Ben Robinson, who died from second impact syndrome. He took a knock to the head and had a concussion, had quite clear, obvious concussion symptoms. He then carried on playing and subsequently had 1 or 2 further knocks to the head and died on the field. And his parents are amazing. They've campaigned relentlessly for better management of concussion. The adage that many of you will know, which is, if in doubt, sit them out, I think is a really important thing to hold on to. That if you are watching sport and you are worried that someone is taking a knock to the head and not behaving right, really encouraging that person to come off the field, because those risks are there. Just on that, I was reading and saw a few clips the other day. I mean, these things, it still happens, believe it or not. This was in Australia in the NRL, so that's rugby league. A player took a huge impact to the head in the warm-up, was quite clearly concussed. He then took a further knock in the game, and I believe came off for a head injury assessment, but then carried on again, and then finally took another knock and had seizures on the pitch, and then needed emergency surgery for a bleed on the brain. So these things are not without risk, and it's really important to bear that in mind. I think that quite nicely summarises the short term. There are medium term risks here as well, aren't there, Matt?
Yeah, absolutely. And I think that's the bread and butter of our job, isn't it, Mike? Through some of the post-injury rehabilitation we do with Meliora. The medium term is the risks after a concussive injury when they leave the elite sports field, when they're going back to their working life or their studies at school. The risks are this cognitive delay, fatigue, brain fog. I'm not going to name them all because the symptoms can be quite varied, and the duration of symptoms can be quite varied as well. Like, some people will recover after a few days. Some people, it will take several months.
Yeah, absolutely. The vast majority of people who have a concussion will recover fairly quickly. The symptoms usually settle down within a week or two. I think the quoted stat is about 80 to 85% of people will be symptom-free by that 2-week mark. But that does leave a significant proportion of people who have some ongoing symptoms, so beyond that 2 weeks. And that's often for reasons that aren't necessarily concussion related, but they're related to the injury. So neck issues or what we call vestibular ocular, so your balance and your visual symptoms. But we also see it a lot when this isn't managed correctly. So someone tries to ignore symptoms, they go back, they carry on exercising to the degree that they want to, they go back in and play more sport and contact sport, or they push themselves too hard. And actually that's where we hear a lot of varying guidance. They go to A&E, they say, rest for a few days and then you can go back. They go and see their GP who says, no, do it for a week and then go back to normal life. And then I think we also hear kind of people with the old-fashioned approach of saying, actually, no, you need to rest until you feel better. We know now that that's not the most effective way of doing it. And actually, that's why we guide people through what we call a graduated return to sport and activity. So I think getting that knowledge out there is really important. You summarised very nicely there, Matt, the medium-term risks. Now, the long-term risks, I think, is a harder topic to address because I think there's a lot here that we don't yet know with any certainty. What we do know now, without any doubt whatsoever, I think, is that we know that the more concussions you have, the increase the risk of your brain health being affected long term. Now, there are loads of factors that play a part in this. There's your genetics, there's your lifestyle, how you live your life. So it's very difficult to say to what degree that will be. There is also a lot in the media about CTE, so chronic traumatic encephalopathy and early onset dementia. There have been some notable cases of ex-professional sportsmen developing motor neurone disease. And actually, the evidence is quite alarming. It does suggest that those neurodegenerative conditions are much more common in ex-professional sportsmen, particularly those of contact sports. So there is a correlation there. And there's been some very high-profile legal cases in American football over in the US, and there's some legal cases going on in rugby in the UK as well. So this is related to the feeling that these repetitive head knocks and repetitive concussions have led to damage to the brain, this build-up of proteins called tau in the brain matter that can result in early onset dementia and significant problems in later life. So it's a really hot topic. It really brings the spotlight on management of concussion. Perhaps more importantly than concussions, it's those repeated knocks to the head over and over and over again that don't necessarily bring on concussion symptoms, but can have this cumulative damage to the brain. It's also important how many years you play. The problem is there's a lot we don't know. So we don't know how many concussions is too many. How many concussions means that you have to stop playing contact sport? How many concussions mean that you're going to have issues that you'll notice in later life? So there's a lot of uncertainty here. And actually, because CTE, for example, can only be diagnosed post-mortem, it's also really difficult to make that diagnosis. A lot of the symptoms that we see with CTE, they're quite non-specific. Again, they can be present in a lot of different situations. So the risk is there, and I don't want there to be any kind of uncertainty there. This is an issue. The problem is that we just don't know the absolute detail here. So it's quite difficult to give that. It's quite difficult to give that advice in full, but it's important we have those conversations.
Yeah, good. I think you've given a nice dose of balanced pragmatism there, haven't you? Because it's important that we don't get too hysterical over the high-profile cases that happen in the news. Because, as I'm sure we'd all agree, and we'd both certainly agree, that there's huge benefits to being involved in sport and getting involved in school sport, professional sport, etc. So it's great to have that dose of pragmatism in terms of weighing up the evidence here as well. So Mike, I guess the important question is, there's more technology now, there's more monitoring, there's more guidance, there's more rehabilitation, but can we actually prevent concussion happening in the first place?
Yeah, great. And I love talking about this. Again, as I said, concussion nerd, but I think this is useful and it ties in nicely with what we do in the podcast, I guess. But so, yeah, there are lots of claims here. And if we start with prevention, so there are a lot of people trying at least to come up with a holy grail, with something that's going to actually reduce the rates of concussion. So we're going to run through a few of these and basically explain whether they have any evidence or they don't. So I think the first one that everyone asks about is headgear. So scrum caps playing rugby or other contact sports. There's Guardian caps in NFL in America. These are these massive devices that look like you're wearing some sort of space helmet. There's something called halo devices. These look like kind of headbands that you wear across that rotate as you take an impact. The headlines here is that nothing has been shown to reduce concussion rates, unfortunately, yet. And any company that is making that claim with any of these devices is not being upfront and is trying to take your money for no good reason. Scrum caps are very good for certain things, so they will stop you getting scrapes and cuts, and maybe even cauliflower ears. There are some scrum caps that have been shown in lab conditions to reduce the amount of force. This hasn't been replicated in real life situations. So whilst it's a watch this space, and who knows, in a few months or years, we may have one that actually has been proven to reduce rates, there's nothing yet in terms of headgear that is proven to work.
Can I just chip in there, Mike, about the scrum caps? Because something I quite like to tell patients when they ask about that is that this idea of having this kind of padded thing on your head reduces some of the energy that's transmitted as a blunt direct force to the skull, but how that increase in diameter of the skull when there's a glancing blow, and how that can increase the energy of this leveraged force that causes the rotational force through the skull, which we know can also cause concussion by that kind of shearing of the neurons, I think is an important point to make. And also how some of these hats that we see, particularly in the younger population, can make certain players behave like they are, invincible, and they can throw their head into any contact because they've now got a scrum hat on. And obviously that's patently not true.
Yeah, absolutely. And I think that's a really good point to make, is that a concussion is that kind of rotation or the shaking of the brain inside the skull. It's not necessarily the direct impact. It's why we see concussions with no head impact whatsoever, with that kind of whiplash. So if suddenly someone is stopped, their head rocks back, it's that rotation of the brain or that movement of the brain inside the skull that can cause that injury. Now, Matt, I want to ask you what I know will be the weirdest question that I've ever asked you on the podcast, and that is to ask you whether woodpeckers get concussion.
Yes, now I've just seen that written in the notes, and I kind of had a slight panic when I was thinking, what on earth is this about? I have to say, Mike, I have no idea. Do woodpeckers get concussion?
It's not a question that most people think about, I think, on a day-to-day basis. But once you consider it, it does make you think. The reason I bring it up is because, believe it or not, this has formed the basis of some scientific research, or at least some development of devices. So there is a company that, based on the fact that there seems to be more fluid around the brain in woodpeckers, and that the feeling is because they're hammering away on the tree all day and they seem to be fine, can that reduce rates of concussion? So actually there is a company that have developed something that essentially sits around your neck. It places a little bit of pressure on your jugular vein, which reduces that fluid to leave the skull. And so in theory provides a little bit of padding around.
Whoever gave funding to that medical company, I would love to sit down with them and find out if they were sober when that was thought through and developed.
Yeah, I mean, you say that, but you see professional athletes wearing this. People buy into this. Look, it will come as no surprise to you to hear that there's no evidence that this works. You know what? There's not even any evidence that woodpeckers don't get concussion. In fact, I think the feeling is that their brains do actually demonstrate a degree of trauma from hammering on that bark all day. So that's one worth mentioning, but there's no evidence for that in terms of reducing concussion. I think just moving on, there's a couple of things that people ask me also about a lot, and one of these is mouth guards, and specifically in terms of these mouth guards that can measure force that goes through the brain. These are being used in the elite sport setting. They're also being used in the amateur sport setting. What happens is that it's a mouth guard that's got a little sensor in. When someone takes an impact, you can look at the G during an impact. The issue with this is that we don't know yet what the force is required that is going to result in a concussion. They're set at certain levels by which we say, look, if you get an impact of 75 G, that necessitates you being checked out by a doctor, brought off the pitch and answering various questions to check you out. Now, we've seen cases where concussive symptoms can occur at much lower force than that. Equally, we can see impacts of 100 G plus that don't seemingly result in a concussion. So I think there's a place for these, and they're particularly good for measuring load and training volume in terms of the forces going through the brain. But I think we just need to be a little bit careful about not looking at these as a kind of panacea that are going to suddenly solve the concussion problem straight away. So I think they may have a place, but again, they're not preventing anything at the moment.
I'll move us on then. So what can we do when we get concussed? And I think it's important to just frame this and saying, look, this again is going to be different for everyone. There's going to be different severities of concussion, different approaches. But I think we're growing more aware, that you alluded to at the start of the show, that it's no longer a case of just resting, is it? A certain active rehabilitation is now much more prescribed. I think I'm right in saying that focusing on good hydration, nutrition and sleep are some of the key pillars to recovery. And this kind of active rehabilitation that we talked about, Mike, didn't we, where it's not a case of just resting, is it? It's a case of being active and being engaged with society, your friends, with sport, but not exposing yourself to another head injury. But that kind of active rehabilitation is important, isn't it?
Yeah, totally. And I think it is important to mention things like sleep, hydration, diet, because actually those sound really simple, but they do make a difference. Screens is an interesting one, I think, because looking at screens can make your symptoms worse in the early stages of a concussion. But equally, avoiding screens completely can also have quite a detrimental effect, because actually, you know, you're already feeling rubbish. You've had this injury. You're looking at the prospect of modifying your life in some way, whether that's sport or otherwise, over the coming weeks. I think if you then isolate yourself and don't look at your screens and can't watch telly and can't contact your friends, I think that even makes that worse. So I think we talk about this kind of Goldilocks approach, where we want to get moderation, allow a little bit of screen time, but not spending hours gaming and in front of screens, I think is important. You're right in terms of this approach. It's not just rest now. So I think rest is really important in those first 48 hours after an injury, and that has been shown to be very effective. But actually, beyond that, trying to get back to a little bit of day-to-day on normality is super important. As recently as a couple of years ago, it used to be that for 14 days, you pretty much didn't do anything, and then you started getting back to it then. All of the research has moved away from that now. We know that actually getting back to low-risk activity after the first week or so is by far the best way to recover. You know, that's good for your autonomic function, which can be affected after a concussion. It's really good for your well-being. It's good for your fitness. And actually, we know that can massively help. So I think that's really important. We then, just to summarize, beyond that, we tend to then get back to a little bit more real sport or training, a couple of weeks after the injury, and then build up from there, so that, you know, when we return people back to sport at the 21-day mark or beyond, they've been well for a while, they've increased their activity and they've remained well. So I think those protocols can seem quite restrictive and can seem quite frustrating for many, and I get that. They are there for a reason, and it's based on the fact that actually, if we look at the median time for how long it takes people to recover and get back up to speed following concussion, it's around that 21-day mark. So I think it makes sense. You, though, Matt, work in elite sport. don't you? And the guidelines are fairly different.
Yes, I do, and it's really interesting that you've just mentioned how 21 days is the median time for someone to recover from a concussion. That is markedly different to the protocol that's outlined for those in an elite setting or in an enhanced setting. So this is a 7-day window. It's much more intensive, i.e. these players are getting assessed every day, much more vigorously as well, I would say. But what I don't think it does is explain why those elite players are allowed to return after 7 days when we've just talked about the median time being 21 days. I think this is born out of a necessity to try and get elite players back playing as fast as they can. The turnaround time is typically 7 days when you home match to an away match. And I guess it is picking up on, are those players making a recovery? Are they jumping through the hurdles faster than was expected of them? And are they then safe to play in 7 days? And I would say that although it sounds rushed, if any player is struggling to make progress through that journey, then it gets delayed and staggered back. And I think it is a much more in-depth scrutiny of those players who've gone through a concussion protocol. But I think it is still interesting how it contrasts so differently to a concussion protocol outside of an elite setting.
We did want to touch briefly upon a couple of the other treatments that maybe there are some claims about, but aren't necessarily in the guidance. So the first one is our old friend creatine. And so just to plug our own podcast, if you want to go back and listen to an episode, we've done a whole episode on creatine. But this is potentially interesting. It's an area where I know of some people who will advise creatine post-concussion. I think it kind of makes sense in terms of thinking how creatine works. I think it's unlikely to do you any harm as long as it's done within the doses, but it's not standardized guidance. There's no convincing evidence for the use of it yet.
Do you want to just explain briefly about ATP and the mechanism behind why creatine is proposed?
Yeah, put me on the spot
or
there,
not
Matt.
if you
Thanks
don't
for
want
that.
it.
No, I think I can. I mean, I think as we've talked about in our episodes, that we know with concussion, we feel as though there's this big energy deficit in the brain, and it can take a while for those energy reserves to get back to normal. And that's where it leaves the brain in quite a vulnerable state, potentially. So creatine is thought to enhance bioenergetics by increasing these phosphocreatine stores, and that in turn may help to maintain ATP levels during that post-concussive energy crisis that we talked about. So the theory makes sense. It just, I don't think the convincing evidence is there in terms of something that we would routinely be recommending. Moving on, there's just a couple of extra things that we're going to mention. So cooling. A player or a person gets a concussion, they come off the field in a sporting setting, and they have what looks a little bit like a scrum cap put on their head, and this pipes kind of icy cold water through the scrum cap and cools the brain. Now, again, I think the theory is there. I think there has been some preliminary evidence that suggests this might help. Been limited a little bit by an inability to double blind that study, so it's impossible to make the participant think that they are getting that cooling when they're not.
We've had a lot of people asking about supplements as well, haven't we? Things like magnesium, omega-3. What's your take on those?
Yeah, again, so a lot of claims there with supplements. I think the two you mentioned, so magnesium and omega-3, are perhaps the ones with the best evidence. I still wouldn't have said it's entirely convincing. It may do a bit of good. It's probably not going to do a huge amount of harm, but I certainly wouldn't be looking at these as a treatment per se. Taking your magnesium and your omega-3 is not going to suddenly make your symptoms go away or discernibly make things much, much better, but look, it may help a little bit. I've done a lot of talking here. I think we're gonna round this off. The takeaway points here. What's key to remember when we're talking about concussion? What do our listeners need to think about?
Yeah, Mike. Look, it has been nice hearing you talk about this. Genuinely, you are clearly an expert in this, and I think it's fair for me to say that. So yeah, thank you. What are the key takeaways here? So look, I think in terms of concussion, we've talked about it's a broad range of symptoms. It's a broad condition, but we've also talked about the importance of how balancing some of the scare stories and the high-profile cases that are in the news and how that might be linked to this CTE that you talked about, balancing that with what we've probably not emphasised enough is benefits of sport and the benefits of being able to participate in activity. We have actually talked about exercise on another episode and how, just that fundamentally is so important. I think there's some interesting ideas in how to prevent concussion in terms of these devices that we've talked about. I think we can probably safely say that there isn't really much evidence behind any of them at the moment. But what is really making a big impact is this awareness of concussion and the updated guidance on how we can all manage concussion and rehabilitate actively through that. I think is my key takeaways here, and that's what's actually making a difference. How about you?
Yeah, absolutely. And I think you're right. I would probably have come across with a slightly negative skew, but I think it is important to emphasize these benefits of activity and living your life and doing sport are just so important for every other aspect of your health. So we can't get too pent up on that. I think it's all about, though, that if concussions do happen, it's identifying them, which is key, and then it's managing them correctly. It is worth speaking to a medical professional, hopefully one who knows a little bit about concussion early on. All of the evidence suggests that the earlier you get that good advice, the swifter that recovery is, and that stands up to some pretty good evidence there. So I think that's probably a takeaway point. I guess we worry also about the plight of the woodpeckers because they are clearly undergoing some damage to their brain. So I don't recommend compressing your jugular vein anytime soon. Matt, I enjoyed that. I love talking about concussion, and I hope that has been interesting to listen to. We've been Beyond the Limits. Please give us a like, a subscribe, follow the podcast, and we look forward to seeing you again soon.
Cheers, Mike.